Hello everyone. So today I'm going to talk about joint pain with regards to plab 2 exam. So whenever you get a patient with joint pain in plab 2, the first thing that you are going to do is you will ask Socrates. As I have already told you, whenever a patient presents with any kind of pain, the first thing that you need to do is to ask Socrates, that is site, onset, character, radiation, aggravating factor, and relieving factor, and the severity of pain. Okay, this thing is constant for every type of pain. All right. Once you are done with Socrates of the joint pain, then you need to ask about other joints. Okay. So, for example, if the patient has right knee pain, then you will ask about the left knee as well. If the patient has right ankle pain or right big toe pain, then you will ask about the left big toe as well. So, the symmetrical joint on the other side, just to know whether the joint pain is symmetrical or asymmetrical, because we have different differential diagnosis for each type of joint pain. Okay, then you will ask about the other joints in the body as well, and anything else apart from the pain in the specific joint. Okay, so there are many differentials for joint pain, but the most important differentials that you need to ask are summarized in a mnemonic that I want you to remember, and this is called GROSS. Okay, so G for gout, R for reactive arthritis, and rheumatoid arthritis. Kindly add rheumatoid arthritis here. I forgot to add it, and O for osteoarthritis, S for septic arthritis, and another S for sports and trauma. All right. Now, as you can see here, I have written functionality. Now, this point is the one that I would like to emphasize a lot because, as you already know, that we ask about psychosocial in most of the stations. In each station, we ask about psychosocial, which includes so whom do you live with, and what do you do for a living, and is this condition affecting your job, and is this condition affecting your daily life. But this become even more essential in rheumatology when a patient presents with joint pain or when a patient presents with muscle pain or muscle aches. This is the absolute essential point which you cannot miss at all. Okay, you need to ask, how is this condition affecting your daily life? Okay, are you able to do your activities of daily living? And how is it affecting your job? This point is so important that if you miss it, then you are likely going to fail the station. Okay. Um, so three things, not only for joint pain, for any type of station, I want you to remember. In each station, when you are going to end the station, always ask, have I asked three things? Okay, like make a triangle in your brain, and you need to fill this triangle in each station. The first thing is red flags. Okay, red flags for the condition that the patient is having. Have you asked the red flags? Next thing is ICE, ideas, concerns, and expectations. Okay. And the third and the last thing is psychosocial. So you need to fill this triangle in all the stations of plab 2. You need to ask red flags, you need to ask the psychosocial, and you need to ask the ideas, concerns, and expectation. Now, many people skip these, like many people have a habit of skipping ideas, concerns, and expectation, and they don't even have the insight unless someone pointed out for them. And not and the practice partners, they are also not always aware of this point. So for you to remember this point, I would like to suggest that imagine this, that you have 16 patients in plab 2 and you have 16 concerns as well, and you have to address these 16 concerns. Okay, and you have 16 patients in plab 2 and you have 16 red flags to ask. All right, so think of it that way and then you will never forget. All right, so what are the red flags for our joint pain patient? So for every patient with joint pain, you need to rule out two red flags. One is fever, the other is trauma. Okay, so every patient with joint pain, you will ask, do you have any fever? And have you hurt yourself by any chance? Okay, so fever is for septic arthritis. Okay, septic arthritis is a red flag. You need to admit this patient and you need to start this patient on sepsis protocol. And the other is the trauma patient. Trauma, because if a patient after trauma presents with joint pain, then it means either the patient has an intra-articular fracture, for which we need to, admit the patient and maybe perform a surgery. Okay. And the second thing, trauma and pain after joint pain after trauma can mean hemarthrosis. Then again, the hemarthrosis patient, you have to admit and you have to aspirate the blood from the joint. Otherwise, it will, get clotted there and it will deform the joint. So remember these two red flags, fever and trauma. Okay. So all of this, Socrates, differentials, red flags, this include P1, okay, which is history of presenting illness. And then the P2 part means past history. So you will ask any history, has this happened before? And do you have any history of any significant medical condition like diabetes, hypertension, etc. Then P3 means meftosa, which is medication, allergy, family history, and psychosocial. And caffetex, which is smoking. So C is for cigarettes, smoking, alcohol, food, and exercise. All right. So this is the history taking part. After this, you need to ask the patient whether they have any idea, any thoughts on their mind, what might be the cause of their symptoms, any specific concerns, and any specific expectations from the team today. All right. After this, you need to move on towards examination. So in a patient with joint pain, you will examine vitals and you will examine the joint. So for example, if a patient with rheumatoid arthritis present with, pain in their fingers, then you will examine the vitals and you will examine the finger joints. Okay. Then you will move on to the management. So for each type of joint pain, you will do some investigation, some specific investigations. These will include CBC, ESR, and CRP, which are inflammatory markers, and they will be raised in any inflammatory arthritis, ANA, to rule out any autoimmune condition like SLE, NTCCP to rule out rheumatoid arthritis, and joint X-ray, which will tell you about osteoarthritis and the level of damage in the joint. Okay, symptomatic treatment. So as joint pain is pain, of course, you will give painkiller as symptomatic treatment, which is NSAIDs. Now this point, the third point is again very important. Every patient with joint pain, with the exception of maybe osteoarthritis, but every patient with joint pain, you will refer to PT, OT, and rheumatology. It means physiotherapy, occupational therapy, and rheumatology. Even osteoarthritis patient you will refer. Okay, so physiotherapy, occupational therapy, and rheumatology. So three referrals for each joint patient: PT, OT, and rheumatology. Please remember it. Okay. So to complete your management, you must tell the patient that I will refer you to physiotherapy, to occupational therapy, and to the specialist of joints, which is called rheumatologist. Okay, now let's discuss each differentials and its management in detail. So reactive arthritis, for example, you have a patient with reactive arthritis. Now, reactive arthritis, as you are aware, that it is a kind of arthritis that occurs after, any sexually transmitted infection, or it can occur after any gastroenteritis, for example, by Campylobacter jejuni. And the mnemonic to remember osteoarthritis is can't see, because in reactive arthritis, eyes are involved. So there is uveitis, there is conjunctivitis. So can't see, can't pee. So can't pee means the urinary involvement, which is the UTI, and can't climb the tree. Can't climb the tree means his joints are involved. There is joint pain, so the patient can't see, can't pee, and can't climb a tree. Okay, this is reactive arthritis. So you will come to know that the patient has reactive arthritis during the history taking part, where he will tell you that he has, problem in the eyes. Also, maybe he will give history of recent urinary tract infection or recent diarrhea, and he will have joint pain. So, how will you explain this to the patient? You will tell the patient that you have a condition that cause redness and swelling in various joints of the body. It is called reactive arthritis, and it usually develops after an infection, specifically a sexually transmitted infection or diarrhea. Okay, investigations, you will order the above investigations, that is inflammatory markers, ANA to rule out SLE, and TCCP to rule out rheumatoid, and you will do urinalysis and maybe STI screening, and maybe STI screening for the sexually transmitted infection, and you will also do joint X-ray. Now, treatment will be NSAIDs and antibiotics. Now, antibiotics are basically for the infection. So, NSAIDs and antibiotics. So antibiotics, they don't have any role in clearing up the joint pain, but they will obviously clear up the infection that is the cause of the joint pain. Now, referral. So for referral, you will first of all refer to the physiotherapy and occupational therapy. You will arrange a follow-up after a few weeks, and if the patient is still not better, then you will refer to rheumatology. Also, please safety this patient for septic arthritis. So tell the patient that if you have any fever, then please, or you generally feel unwell, then please go to the emergency department. Okay. All right. Then after this, we have gout. So gout, as you all know, there is excessive uric acid, and the uric acid gets deposited in the joints, and it causes joint pain, especially involves the big toe. How you are going to explain this to the patient? Because we always start our management by explaining the condition to the patient. Okay. So we'll tell the patient that you have a condition that causes sudden severe joint pain, especially in the big toe, and this is called as gout. There are various risk factors for it, and during the history taking, you will come across some risk factor in the patient. So the patient can be either obese, or he can be hypertensive and taking diuretics, or he will be consuming large amount of alcohols and meat, which are basically the risk factors for gout. So you will tell the patient that in your case, you have this and this risk factor. You will do all the above investigations, and treatment is, so symptomatic treatment here, basically a symptomatic treatment which is NSAID. They are also kind of a specific treatment because they help to resolve the attack as well, because gout is essentially inflammatory arthritis, and the NSAIDs also settles down inflammation. Okay. You can also give steroids because steroids also have essentially the same function, settling down inflammation. So NSAIDs are both symptomatic and specific treatment in acute cases of gout. Also, you will give advice, general advice that please rest and don't walk a lot, and keep your limb raised, okay, on a pillow or something. Use ice packs. It will help resolve the inflammation, and it will also decrease the pain, and avoid, alcohol, red meat, and seafood. Okay. So yeah, and you will safety net this patient for septic arthritis. So you will safety net this every patient of joint pain for septic arthritis, because septic arthritis is basically because of an infection of the joint. But any patient who has already some joint disease, okay, either gout, reactive arthritis, rheumatoid arthritis, or osteoarthritis, where the joint is already damaged, it is more, these patients are more prone to develop septic arthritis. So you will safety net these patients. You will tell them that if you develop any fever or you generally feel unwell, please visit the emergency department. I'll call 999 for an ambulance. Okay, now rheumatoid arthritis. So rheumatoid arthritis, the typical patient of rheumatoid arthritis is usually a young female, and they present with pain in the symmetrical pain, on both hands, usually present with hand pain, and they tell you that there is some morning stiffness, and this improves during the day. So you will explain it to the patient that you have a condition that causes inflammation of the joints in the body. It is called as rheumatoid arthritis, and it is due to your defense system acting abnormally and attacking your own joints. Okay, you will order all the above investigations, and of course, anti-CCP will come as positive. So here the symptomatic treatment is again NSAIDs and steroids while waiting for specialist referrals. So you will refer this patient to PT, OT, and rheumatology again, and will tell the patient that the rheumatologist will start them on specific medications, which are called DMARDs, and they will delay the progression of this disease. However, this is a long-term condition, and they may need to take DMARDs for a long time, maybe few years or sometime even lifelong. Okay. Again, safety net, please remember to safety net against septic arthritis. Then we have osteoarthritis. So osteoarthritis, as you are all aware, it is a degenerative arthritis, and it develops with age, also develop with in obese patients, develop earlier in obese patients. So you will explain to the patient that you have a condition called osteoarthritis that causes joint pain and stiffness. It is due to normal aging process. Okay, so this is due to normal aging process because our joints are exposed to wear and tear in our daily life, and this constant low level of damage eventually cause enough damage to cause joint pain, and this is then called as osteoarthritis. But there are certain risk factors as well, like increased weight or excessive use of the joints. Investigations are as above. Everything else will be negative, inflammatory markers, ANA, anti-CCP, everything will be negative. Only X-ray will show degenerative changes. Symptomatic treatment here is paracetamol. There is no specific treatment as such for osteoarthritis, but you will refer to physiotherapist, occupational therapist, and if their condition is really bad, you will refer them to orthopedic specialist for joint replacement. Okay. So this was all about osteoarthritis. Now, for completion's sake, I will also add septic arthritis, although I haven't written it here. But septic arthritis, as you can tell from the name, that this is basically infection of the joint. Okay, and septic arthritis usually develop in those patients who already have a disease of the joint. Okay, so any inflammatory arthritis or osteoarthritis. Now, septic arthritis is a really serious condition. Okay, and the patient will present with high-grade swinging fever, and the joint will be very painful and will be very swollen, and the patient will not be able to move the joint at all. These patients, you will tell them that you have an infection of the joint that has led to the development of pus inside the joint, and it is causing pain, and it is also spread to your blood, and this is causing fever. So you will need to admit these patients, and you will start them on septic protocol, sepsis protocol. So you will inform your seniors, you will do all the investigations, you will like your seniors will do joint aspiration and send it for culture, and you will do the sepsis protocol, which is the sepsis 6, which include give 3 and take 3. So we will give 3, which include three things, like which include oxygen and fluids and antibiotics. Okay, and you will take 3. So the take 3 includes, you will do the joint aspiration, you will take bloods for culture, and you will take lactate, and you will also pass urinary catheter and monitor urine output. So that was all about joint pain, and all the differentials and all the different types of management. And the next video I will make on muscle pain, okay, and all the differentials and management of muscle pain, and that will essentially cover your rheumatology for plab 2. So I hope this video was helpful, and I will see you soon with the next video.